JTech Medical NorthStar software is capable of efficiently managing all of your patient health records for better usability and progress tracking. In Patients, you'll see that the software first prompts us to select a database. We can also open a database by clicking up at the top here. After we've selected our database, we can start adding or modifying patient info. First, note that we have a search field here on the left, as well as the ability to pull up the most recent patients for quick access later. We're going to add a new patient, so we'll click the Add button. You'll see here there are multiple tabs across the top that provide space to create a very detailed patient record. You can add as much or as little as you want. The only field that's absolutely necessary to start testing is the first name field, but in order for certain values to calculate properly, we'll need a little more info. So our sample patient here is going to be male, right-handed, and in his mid-40s. Let's click over to the Personal Background tab. Remember that anywhere in the software you see this icon, you can create custom list items. So if you don't see an appropriate built-in entry, you can always add the more common items you see in your practice. There are many fields here, and you can collect as much or as little information as you feel is needed in your practice. Here in the Medical History tab, you have fields for allergies, medications, past diagnoses and surgeries, and we can also make a note that there are no significant findings by clicking on the radio button here. If we click the Custom Lists button here, you can see that the software comes preloaded with common allergies, medications, and even some common diagnoses. Again, you can customize these lists to make the process as streamlined as possible for your practice. You can track family history here. Again, completely customizable. In Complaints, we're going to click the Add button to start a new complaint, and I'm just going to enter some quick information here. You can track complaint history to help determine if your treatment plan is having the desired effect as well. Let's go to Employment. This tab is helpful for the FCE, employer services, and post-offer clinics, but can be useful information even if you don't offer such services. Before we can begin testing, we need to create a visit. Click the Add button here. I'm going to select one of the default descriptions, but remember you can edit these lists at your discretion. Care providers. Information you enter here will auto-populate the contact info in your reports. If you don't add a care provider, the default provider will appear in your reports, and that can be set up in your Settings menu. We can also add detailed case information, and, as you'll see in many screens throughout the software, a field to enter any notes or observations while you progress through the software. Click the Save and Close button to continue. Now at the top of the software, you'll notice we have our current database, patient, and visit information. Clicking any of these fields will jump back to their respective screens, and we can also close out of our current patient or database by clicking the Close button next to each field. From here on, whenever we want to open a patient, we can simply click the Open Patient button to open our Patients dialog and quickly select from our current database. Objective physical assessment is a huge component of NorthStar, and there's much more to the test section than we can thoroughly cover in this video, but we'll give you a broad overview of testing, then go more in-depth in a future tutorial video. NorthStar has been built to work seamlessly with our NorthStar Echo wireless evaluation product, but you can also enter data manually in almost any testing screen in the software. For the purposes of this tutorial, we're going to assume you already have your instruments registered. If you need assistance with this step, please feel free to contact JTech Customer Service or refer to your user manual for more information.